अस्सलाम वालेकुम। आज हम इंशाल्लाह स्टार्ट करेंगे कंजंक्टिवाइटिस, conjunctiva basically. First topic in conjunctiva we will discuss is conjunctivitis. So I'll try inshallah after this session conjunctiva is finished in 4 sessions. फिर उसके बाद the important things in conjunctiva we'll discuss. Now before we move on to conjunctivitis proper, first I want to discuss the differentials of red eye, and afterwards we will have a brief overview of conjunctivitis in today's session. Right? So when I talk about red eye, what are the differentials which should come into your mind? And a patient presents with a red eye. It's one of the classic symptoms and there are a few diseases linked with it. Now, what are the differentials of red eye? No, those are the symptoms. Those are the associated symptoms in science. I want the differential diagnosis of a red eye.
Conjunctivitis, bee sting, orbital cellulitis, Joe.
Conjunctivitis, that's good. Number 1, we have conjunctivitis. You also said orbital cellulitis. That's also an important differential. और क्या हो सकता है?
Uveitis.
Uveitis. Uveitis. और क्या हो सकता है?
Trauma.
Trauma. Excellent. Trauma हो सकता है. और
Acute congestive glaucoma.
acute angle closure glaucoma. और क्या हो सकता है?
Allergic reaction.
Allergic reaction. Now the allergic reaction will either be a conjunctivitis or it will be a uveitis, or मुझे इसके याद नहीं आ रहा, but it can also be a keratitis. We have keratitis / corneal ulcer. होता है ना corneal ulcer में भी red eye. Corneal ulcer is one. The differential added. One more differential. एक और.
Scleritis and episcleritis.
Scleritis and episcleritis. That is excellent. Scleritis and episcleritis have been studied. They also cause a red eye. चलो इनको हम अलग-अलग देख लेते हैं. और what else? कुछ भी बता दो, even if they've been repeated or subject. क्या चीज?
Foreign body.
Foreign body, all right. Foreign body. That can also be a cause of redness in the eye. That's good. One more.
Hemorrhage.
Hemorrhage. What kind of hemorrhage? Be more specific. Trauma में तो हम discuss.
Conjunctival or subconjunctival.
Subconjunctival hemorrhage. Yes, subconjunctival hemorrhage. Subconjunctival hemorrhage. Most commonly it's due to trauma, but we'll find it. So these are more or less your differential diagnosis of a red eye. Whenever a patient presents to you, in the question stem of vignette, it's given, and the patient presents with a red eye, these are the things which have to come into mind. Conjunctivitis, orbital cellulitis, uveitis, trauma, glaucoma, keratitis, corneal ulcers, scleritis, episcleritis, foreign body, subconjunctival hemorrhage, all these things. So briefly we'll go over these again, and then we will move on to conjunctivitis. Now I'll show you a series of pictures. You have to tell me the diagnosis, not immediately. Take your time. You will have 1 minute, and then we will discuss why this picture is that specific diagnosis. All right. So this is our first picture. We will discuss the findings and then we will confirm our diagnosis. All right. Take a few moments. Look at this picture. This is an anterior chamber optical coherence topography. The cornea. and this is the iris, all right? The cornea and the iris, they're relevant to this picture. So let's see this picture first. What are your findings in this picture?
Eyelids appear normal.
All right, an excellent negative finding that the eyelids are normal. There's nothing wrong with the eyelids. और हमें क्या है क्या नहीं है? Anyone else?
Conjunctiva पे redness है.
Conjunctiva is
Diffuse.
red, diffuse redness of the conjunctiva. That's a positive finding.
No circumciliary congestion.
Minimal or no circumciliary congestion. That is a good negative finding. जो नहीं है present इसमें, because these tend to rule out differentials.
No discharge.
No discharge. Now that's an excellent finding. No discharge means that which disease is unlikely?
Conjunctivitis.
Conjunctivitis is unlikely because conjunctivitis has discharge. और क्या है इस तस्वीर में?
No hypopyon.
No hypopyon. So a hypopyon, the absence of a hypopyon, it rules out
Infection.
Uveitis.
no. Not infection. You
Uveitis.
cannot say infection. Uveitis, anterior uveitis. You know, hypopyon is a sign of anterior uveitis. अब जरूरी नहीं है कि हर anterior uveitis में hypopyon हो, but it makes anterior uveitis unlikely. क्योंकि और भी signs होते हैं ना. Hypopyon is one of the signs of anterior uveitis. So there is no hypopyon. A hypopyon should appear right over here. So that's a good negative finding. और क्या है? Any other positive finding?
Dilated pupil.
Pupil dilated है.
A dilated pupil. Okay. So a patient who presents to you with a right red eye, a painful right red eye, he has no discharge, his anterior eyelashes are normal, there is no hypopyon, there is minimal or no circumciliary congestion. What will be your diagnosis be? Given this picture also, this OCT?
Acute angle closure glaucoma.
This is an acute angle closure glaucoma. Okay, we've discussed the negative findings of acute angle closure glaucoma. May you will find generalized congestion, a dilated and somewhat irregular pupil, and you will find a narrow anterior chamber. Okay, narrow or closed anterior chamber. Thus, all the other signs of other diseases like hypopyon, conjunctival discharge, etc., they will be absent. So this is acute angle closure glaucoma. थोड़ा सा वेग है बाकियों के मुकाबले में ये, but nonetheless it's very important. It's an important difference. Moving on. Take your time to look at these two pictures in the center.
Intense redness एक साइड पे.
ठीक है, चलो हम डिस्कस करते हैं. Positive findings. The above picture first. Intense redness on one side. Intense redness. Now, how do we quantify this or classify this redness? Because redness is a lay term, right?
Diffuse.
This is, no. What is this called actually? Redness. Redness तो हमने देखा है किस तरह हो सकती है. You will further classify the redness.
Hyperemia.
Hyperemia or congestion. That's good. Conjunctival, diffuse, ciliary, or both?
Both.
It's both. Why is it both?
Because उसने वहाँ पे surround किया हुआ circumciliary congestion. Limbus.
Because the congestion is also diffuse on this side, and also the circumciliary vessels. Circumciliary meaning that those at the limbus are hyperemic and congested. There is a lot of blood in them. Compared to this picture, in which we see that the circumciliary vessels, these vessels, are not so congested. That is a good finding that there is diffused and circumciliary congestion. और क्या है?
Constricted pupil.
A pupil that is constricted. That's a good finding.
Iris is discolored.
Iris is discolored. कहाँ discolored है?
अजीब सा कलर है.
सिर्फ अजीब सा कलर है.
Eyelids are normal.
The eyelids are normal. ठीक है. So that's a normal finding that the eyelids are normal. These are lids and they are normal. ठीक है. Nothing is.
Eyelashes पे कुछ yellow सा है.
Eyelashes से कुछ yellow सा लगा हुआ है. That's good. ठीक है. So what is this yellowish thing which is on the eyelashes?
Stain है.
That is a stain, and the same stain is somewhat present over here. ठीक है. This is the same stain. So, what is your diagnosis? In a patient who presents with a red eye, he has diffuse conjunctival and circumciliary congestion. There is staining of the cornea. The eyelashes are normal. The pupil is constricted. There is no conjunctival discharge. There is no hypopyon. So your diagnosis is
Corneal ulcer.
corneal
Keratitis.
ulcer or keratitis. That is good because the cornea is involved and there is circumciliary congestion, the two most important positive findings. Now, similarly, look at this picture.
Corneal ulcer है.
It's a corneal ulcer again. Now, the most peculiar thing about this image is that there is an area which is colored green. Now, what is this area and why is it colored green? बाकी चीजें जिसमें हैं, there is congestion, hyperemia, etc. So we'll be focusing on this. Why is this green? And but why is this green? What is this?
This is stain. Fluorescent stain.
Fluorescent stain, right? So we know that this color is due to fluorescent stain. Now the question is, why do we use this fluorescent stain? What is the purpose of this stain? What is the purpose of this stain? क्यों इस्तेमाल कर रहे हैं हम ये? Fluorescent stain will appear to you yellow. They go more to light. Sorry, greenish yellow. So this is how it should appear. Why do we use fluorescent stain?
For diagnosis of corneal ulcers, yeah.
For diagnosis of corneal ulcers, that's good. कहता क्या है ये stain? Now you know that the cornea consists of five layers. हम इनको discuss करेंगे when we discuss cornea. And the topmost layer is the epithelium of the cornea, right? Now, in any case, in any situation, if the epithelium of the cornea is eroded, you will not see the erosion under a normal slit lamp because so what do? We visualize that erosion with fluorescent stain. Fluorescent stain on the eyes. What is that? Does that? This stain, it binds to the area of denuded epithelium, of the eroded epithelium. So in this case, in this particular case, that area is this area, which is stained green. And also some of this area, some of this area, some of this area, and some of this area, right? So fluorescent stain is used to demarcate the areas where the epithelium has been eroded. And then erosion of the corneal epithelium along with the signs of other corneal infection or inflammation, it constitutes most likely a diagnosis of keratitis. So this is keratitis or corneal ulcer. Ulcer, why? Because we know that in ulcers, the epithelium is eroded. The mucosal surface is damaged. Its continuity is broken. The same is happening over here. So these two were pictures of corneal ulcers. Moving on. ये क्या? ये क्या है, बल्कि इससे पहले इसकी फाइंडिंग्स क्या क्या है. टेक योर टाइम, 10-15 seconds, then we will discuss the findings. Good sign. Positive findings first, then negative findings if there are any.
Eyelids are swollen.
The eyelids are swollen. Are the eyelids specifically swollen?
Periorbital region.
Periorbital, right? There is periorbital swelling along with periorbital
Redness.
erythema. So we have two findings in this one. Periorbital swelling, okay, and redness, erythema. So that is one positive finding. और क्या है?
Discharge.
Discharge. There is discharge coming from the eyes. और क्या है?
Entropion lower eyelid में.
Lower eyelid में entropion. Yes, there's somewhat an entropion because we are not able to see the eyelashes. That's good finding. और क्या है?
Diffuse hyperemia.
Diffuse hyperemia. Yes, बिल्कुल है. Diffuse hyperemia along with periorbital edema. Periorbital puffiness, swelling, not edema. Edema is diffuse. Correct terminology हो जाएगी. This is an active swelling. So this is periorbital swelling, periorbital hyperemia, conjunctival discharge, inability to visualize the lower eyelashes, most probably the lower entropion. और क्या है? कंजक्टिवा पे डिस्चार्ज तो है.
Squint. Yeah.
क्या है, दोबारा बोलिएगा.
Squint.
Squint. How do you know it's a squint?
Esotropia लग रहा है.
Esotropia like that. Now, in order to confirm or do an esotropia, the first thing we have to do is at least see both of the eyes, right? Again, this person, if this person, now we see that the left eye is looking towards the right of this person, right? तो अगर दूसरी आंख भी उसी जगह देख रही है जिस जगह ये आंख देख रही है, तो इज इट अ स्क्विंट? नहीं, तो आपको दूसरी आंख नजर ही नहीं आ रही, पहली बात तो. So you cannot comment on whether it's an esotropia or an exotropia or all that if you only see one eye, because आंख सिर्फ एक आंख की आपको तस्वीर दी हुई है, तो उसमें आप नहीं नजर लगा सकते. इसमें और भी हैं, दो पॉजिटिव्स तो हैं at least which are not picking up. Is the conjunctiva normal behind the discharge?
नहीं, conjunctiva में भी edema है.
Edema है, it's red.
And redness है.
There's redness, so there's conjunctival congestion. Is the pupil normal?
Dilated.
The pupil is dilated. The pupil is dilated, right? The pupil is dilated. So in a person who presents to you with painful red eye, painful red left eye, she has, because this is she has diffused periorbital edema, swelling, active edema, diffused periorbital redness, conjunctival discharge, conjunctival redness. She has a dilated pupil. There is no corneal abrasion, ulcer, or staining in this visible in this picture. And if I were to show you a CT scan of this person, start the white arrows for a moment. White arrows को छोड़ते हैं. What is the finding and then what is your
Proptosis of left eye.
proptosis of left eye? So your diagnosis is
Orbital cellulitis.
orbital cellulitis. Now that's proptosis कैसे हम देखते हैं? These are the bony margins, right, of both the eyes. Now we can see that the right eye is normal, but the left eye is protruding outwards. So this is proptosis. Proptosis, diffuse swelling, conjunctival discharge, erythema all around, painful, and a dilated pupil. This shows orbital cellulitis. Now, why the pupil is dilated? I'm going to reiterate it. अभी और से सुनना ये चीज़. The pupil is dilated because in orbital cellulitis, the periorbital tissue is swollen. All the tissue around the eyeball is swollen. This includes the things we see in the front and also the things we cannot see at the back, including fat, space surrounding the muscles, and all that extracellular tissue. There is so much swelling and so much hyperemia, signs of inflammation. What happens is that there is compression and pressure on the optic nerve. If the optic nerve is pressed, it is not able to convey the signals back to the brain. If that does not happen, and the brain perceives that there is no light coming, it will send the signals for mydriasis, for pupillary dilation. That is why the pupil is dilated in orbital cellulitis. This is orbital cellulitis. Moving on, look at this picture. There are two important positive findings in this picture. Look at it for a few moments, and I want you to tell only those two important positives, nothing else. In your diagnosis. बस तो सब मैं कह रहा हूँ कि थोड़ा टाइम ले लो, बाकियों को भी देख लेने दो. चलो, one positive finding is hypopion. What is the other positive finding? Now, what is the other positive finding?
Irregular pupil.
Irregular pupil. What does this irregularity indicate?
Synechia.
Synechia. So which synechia is this?
Anterior.
Why is this an anterior synechia?
Because it's attached to the cornea.
Okay, the concept is called anterior synechia, where iris is attached to the cornea. But actually in this picture, the iris is attached to the lens. Why? Because irregularities, if you see the iris over here, it's going backwards and it's becoming darker. So that's how I can tell it's going backwards. If it were to be coming to the front, it would have been lighter, and then, because it would have been directly illuminated by the light of the lamp. इसमें बाकी सारा iris हमें clearly नजर आ रहा है ना? The same would have been true if this were an anterior synechia. It's actually darker than the rest of the iris, meaning that it's going backward. So this is a posterior synechia. Posterior synechia with hypopion. These are two signs of
uveitis.
uveitis. Specifically, uveitis?
Anterior uveitis.
Anterior uveitis, right? So this is a picture of anterior uveitis, the two important signs of anterior uveitis. Moving on. There's only one important positive in this picture. What is that important positive? क्या finding है इस तस्वीर?
Hyperemia.
Hyperemia, conjunctival redness, or it appears to be conjunctival redness. So is this circumciliary or diffused?
Diffused.
Because the circumciliary region is clear. Circumciliary region is clear. Can you see the conjunctival vessels? Conjunctival vessels नजर आ रही हैं आपको? हमेशा zoom कर नहीं सकता. आ रही हैं. So do you think that this redness is due to the dilation, congestion, and increased blood flow in these small, tiny conjunctival vessels, or is it behind these conjunctival vessels? Is this redness due to the conjunctival vessels, or is it behind these conjunctival vessels?
Behind.
Why? Because we have seen that in the conjunctival vessels, अगर उनमें congestion हो, this is how it should appear, right? This area. Similarly, इसमें थोड़ी कम है, but you can see that some of the conjunctival vessels are, the arcades are more visible. And look at this conjunctival redness. So this redness in which we are able to see the conjunctival vessels. This redness, we can see the conjunctival vessels, and they are somewhat normal. And the redness is also present behind them. And the redness is also confined to one part of the eye. कौन सा डिफरेंशियल रह गया है जो आपको लगता है कि this suits that differential?
Episcleritis or scleritis?
In which there is redness deep to the conjunctiva. Mostly that's all around it. और इसमें कुछ हमें ऐसे positive नहीं मिलता. There are important negatives to remember. For the last picture, look at it for a moment. Now, what are your important findings, important positive findings in this picture?
Discharge.
Discharge. Now, there's a lot of discharge sticking between the two legs. So we have discharge. One.
Eyelids are somewhat swollen.
Eyelids are somewhat swollen. Yes, they are somewhat hyperemic or affected. That is good. और क्या है इस तस्वीर में?
Conjunctival hyperemia.
Conjunctival hyperemia. All right, diffuse conjunctival. So these three symptoms: discharge, conjunctival suffusion, hyperemia, congestion, somewhat hyperemic and swollen lids. What is your diagnosis?
Conjunctivitis.
Conjunctivitis, right? This is conjunctivitis. Now this discharge, what kind of discharge is this?
Mucoid.
Mucoid, right? It is somewhat mucoid. Now, mucoid discharge, what is the characteristic of mucoid discharge? क्या होता है mucoid discharge? What does it be? Sticky होता है, बिल्कुल होता है ना. थोड़ा सा vague question हो गया. Appearance on the basis of color.
Whitish होता है.
It's completely whitish or whitish. So if there is somewhat yellowish staining of this thing, right? It's somewhat yellow staining. We can see yellow stains all around the eyelashes as well. Yellow crust. This is not completely whitish. It's somewhat yellow. So it's either mucoid or it's one is again थोड़ा सा yellowish material other than it's mucopurulent. Welcome. It's mucopurulent. So this is conjunctivitis. All of these pictures I've shown you before. We've discussed red eye before, and we've discussed all of these topics before, except as and corneal, so ocular हम करेंगे और conjunctiva हम इंशाल्लाह भी start करेंगे. These are the important differentials of red eye which you have to remember. Important signs and symptoms of these cases. Most of the times, the presenting case or the vignette will be the same. The person presents to you with the red eye. It can be unilateral or bilateral. There will be associated symptoms. Associated symptoms: corneal staining, proptosis, immobility of the eye, loss of vision, hypopyon, posterior synecdoche, subconjunctival or deep to the conjunctival, suffusion, discharge, etc. These are the important differentials of red eye which you have to keep in mind. And if you look closely at these pictures and if you identify the positives in them, then you will always remember the signs and symptoms which differentiate, not symptoms, but the signs which differentiate these diseases from one another. Okay. So, we're coming towards our topic proper, that is conjunctivitis. Now, what are the symptoms with which a patient of conjunctivitis can present? Specifically conjunctivitis पर हम अब आ गए. First we will discuss the symptoms with which a patient can present, then we will discuss the signs. और अभी हम इनको discuss करेंगे because there's a lot of types of conjunctivitis, बहुत ज़्यादा है. So in every case we will not go over these signs and symptoms again and again. यहाँ पे necessary होंगे, we will discuss those necessary signs and those necessary symptoms, but we won't go over them again and again. So I want you all to list the signs, symptoms of conjunctiva and then the signs, so we can clear them out before starting the specific conjunctivitis. Now, symptoms. Pain. Pain is a very important symptom of conjunctivitis. और क्या हो सकता है?
Redness.
Redness. आँख लाल हुई है. मुझे किसी और ने आके बताया है, मेरे घर वालों ने बताया मेरी आँख लाल हुई है.
Discharge.
डिस्चार्ज, मेरी आंख में गिद आई हुई है, आंख में पानी आ रहा है, आंख में पीप आ रही है.
Swollen eyelids.
स्वेलिंग, मेरी आंख सूजी हुई है, पलकें भारी हुई हैं.
Foreign body sensation.
फॉरेन बॉडी, मुझे लगता है मेरी आंख में कुछ कीड़ा डला हुआ है, कोई क्या कहते हैं उसको, छोटे पत्थर जो होते हैं, कंकरियां सी आई हुई हैं. ऐसा लग रहा है जैसे मेरी आंख में कुछ बाहर से डला हुआ है जो मैं निकालने की कोशिश करता हूँ, निकालने की कोशिश करती हूँ लेकिन नहीं निकलती. और
ब्लड विजन.
ब्लड विजन, बिल्कुल. पस इतनी ज़्यादा है, पीप इतनी ज़्यादा है, पानी इतना ज़्यादा है कि मुझे नज़र ही नहीं आता. बार बार आंखें मल के साफ करनी पड़ती है वरना मुझे नज़र ही नहीं आता. ब्लड विजन. Focus on how I presented this blood vision history, because blood vision is a component of many other diseases, including diseases of the cornea, the iris, uveitis भी हो सकता है, retina की disease भी हो सकता है, cataract में भी blood vision somewhat हो सकता है, glaucoma में भी हो सकता है. In conjunctivitis specifically, the blood vision will be due to this discharge. यही कहेगा कि इतनी discharge है कि मुझे नजर में मसला होता है. और क्या हो सकता है?
Distortion of eyelashes.
Distortion of eyelashes. Now, when we specifically discuss the distortion of eyelashes, we discuss it in terms of ectropion and entropion. Inward and outwarding of the lid margin, जहाँ पे eyelashes पड़ी होती हैं. So, in acute phase of conjunctiva, जब conjunctivitis होता है, so it's unlikely that a 3 or 4 day inflammation can cause such a rapid change in the orientation or the anatomy of the eyelids. ठीक है, हम खुद भी सोचें ना कि थोड़ा सा इस बारे में, तो a sudden inflammation cannot cause as such a change. हाँ, बहुत ज़्यादा inflammation हो तो as we saw in orbital conjunctivitis, the lid can be, eyelashes can be buried. और ये भी हो सकता है कि if the conjunctivitis is not properly treated, there is scarring. उसकी वजह से ectropion, entropion हो सकता है. So it's a sequelae. And yes, eyelash changes in this case can be a presenting symptom. But you have to remember how they will present. जो मैंने अभी बात की है कि eyelashes और eyelash problems, they are mostly signifying ectropion and entropion. And both of these two, they are more complications of conjunctivitis rather than the initial presenting symptoms or the initial lesions in conjunctivitis. Yes, but a person with chronic conjunctivitis can present with eyelash problems, as we will see in one specific type of conjunctivitis. और क्या हो सकता है?
Lacrimation.
Lacrimation and discharge. So what is the difference between the two? और क्या हो सकता है सिम्टम?
Cornea involved हो तो photophobia.
Corneal involvement, right? You know that conjunctivitis is an inflammation which can be due to an infection or an adrenous cause. If that inflammation spreads to involve the cornea, conjunctivitis में हो जाता है. The patient will present with corneal symptoms as well. Corneal symptoms including photophobia, that will also include lacrimation, all those including pain. So if both the conjunctiva and cornea are involved, then the patient will also present with corneal symptoms along with conjunctivitis symptoms. एक और symptom. One important symptom. This is
Enlargement of lymph node.
Enlargement of lymph nodes. Now that's again a very good, not the one I was looking for, but it's very important. Why is it important? When you finish the symptoms, मैं आपको बताऊंगा. Enlarged lymph nodes.
Follicles और वो वाली बात थी.
Follicles और वो वाली बात ठीक है. That's good. आपको पता है follicles और papilla क्या होते हैं. But those are not symptoms. You will not say follicles. Those will find out on the examination. वो भी हम अभी discuss कर लेंगे.
Itching of eye.
Itching of eye. Now that I was looking for a long time. Itching of eye. Itching. मेरी आँखों में बहुत बार खुजली होती है. Correct. This is a very important symptom. Now, one by one, we will go over these again. Pain, redness, and discharge. These are very obvious. Now, discharge in conjunctiva, it is due to the mucoid glands present in the conjunctiva proper. Conjunctiva के अपने जो glands होते हैं, उनसे release होता है. Swelling of the lids. We know that's inflammation of the conjunctiva. If it can spread to the cornea, it can also cause so much diffuse inflammation that the lids can be swollen. So it can happen if there is a flare of conjunctiva, acute severe conjunctivitis. It can also occur in, we discussed eyelids के disease होते थे, blepharitis उसमें हो सकती है, and it can also occur in orbital cellulitis. So those two differentials you have to remember when you discuss swelling as a symptom of conjunctivitis. Because if they are associated symptoms of orbital cellulitis, or if they are associated symptoms of blepharitis, then conjunctivitis is unlikely. ठीक है, हमारी fourth year level पे जो भी questions या vignettes देंगे, उसमें they will only want you to focus on one disease. वो इस तरह नहीं कहेंगे कंजंक्टिवाइटिस भी है, ये भी है, ये भी है, या 3-4 चीजें एक साथ चल रही हैं आई में. That's above our level. They only want to give you one disease and they want one diagnosis. Okay. Now, blurred vision, again, it will be due to the discharge. It will be different from the blurred vision of cornea, of glaucoma, of cataract, etc. They will have their own list of signs and symptoms as well. Again, same eyelash problems, trichiasis, entropion, ectropion, they will have their own signs and symptoms along with them as well. If there is an eyelash problem, then if there is ectropion, okay, the tears will not be contained. If there is an entropion, the patient will complain of trichiasis. Okay. Lacrimation क्या होती है? Now important. Lacrimation, we know that it's different from epiphora. What is epiphora? We all know that. Lacrimation का मतलब है कि the fluid, the secretion, the tears, they're coming from the lacrimal gland, which is a serous gland. Now, the discharge was from the conjunctiva, from the mucoid glands of the conjunctiva. So sometimes if the mucoid glands of the conjunctiva are present and there's only a foreign body sensation, foreign body sensation में जिस तरह आँख में कोई चली जाए, मिट्टी चली जाए, so lacrimation is a reflex response which happens, right? So that is lacrimation. The discharge is from the mucoid glands of the conjunctiva. Corneal symptoms, again, if the cornea is involved, it will have its own constellation of symptoms. Enlarged lymph nodes. Now, some viral conjunctivitis, they present with another systemic sign or symptom as well. For example, a classical example is pharyngeal conjunctival fever caused by adenovirus. In this disease, there is conjunctivitis, there is pharyngitis, and along with that pharyngitis, there can be enlarged lymph nodes in the neck as well. So, if there are symptoms of enlarged lymph nodes, patient will present with मेरी गर्दन में सूजिश है, गिल्टी बनी हुई है. That means that along with the conjunctiva, something else is being involved. And if there is pharyngitis or along with conjunctivitis or conjunctivitis with lymph nodes enlarged, you should look towards a systemic cause of that conjunctivitis. Okay? Which in this case हमने अभी बताया कि pharyngitis भी है साथ, lymph nodes भी है, conjunctivitis भी, so it can be pharyngeal conjunctival fever. So summary being that viral conjunctivitis, some of the viral conjunctivitis, they can present with inflammation in other parts of the body. And as a symptom and also as a sign of that inflammation, the patient can present with enlarged lymph nodes or giltium. Okay. Now, the last symptom in our list is itching of the eye. Itching signifies the release of histamine. अब histamine कैसे release होती है? Histamine कैसे release होती है? Can someone tell?
Mast cells.
Mast cells, exactly. Mast cells पूरा reaction एक चलता है. तो this reaction, what is this reaction? It's मतलब मुझे पता है type 1 hypersensitivity, all that. It's basically an allergic reaction, right? So itching is an important symptom of allergy or allergic conjunctivitis. You have to remember this. Itching is a very important symptom of allergic conjunctivitis. Why does itching occur? It occurs due to the release of histamine. It occurs when mast cells release histamine. Mast cells are sensitized to any allergen or anything which can cause an allergic reaction. So now then that we've discussed the symptoms of conjunctiva, we will move on to the signs of conjunctivitis. This one papilla and follicles we discussed. But few things before that. Hard and soft symptoms or signs का मैंने आपको बताया था. You remember the concept? थोड़ा बार mention कर लेता हूँ. There are some symptoms which are associated with one disease specifically, like discharge. Discharge is very specific for conjunctivitis. Corneal ulcer में discharge नहीं होता. Glaucoma में discharge नहीं होगा. Uveitis में, retinitis में, choroiditis में, there won't be any discharge. So discharge is a hard symptom, very specific for conjunctivitis. Compared to pain, uveitis में pain होता है. ग्लोकोमा आएंगे तो ग्लोकोमा पेन होता है, केरेटाइटिस में पेन होता है, ऑर्बिटल सेलुलाइटिस में पेन होता है. This is a soft symptom, meaning that it can occur, but it does not specifically point us to conjunctivitis. For conjunctivitis, there are a few hard symptoms. Number one, there is discharge. Then there's a foreign body sensation, somewhat hard. Then there's itching of the eye. बहुत कम diseases में आपको itching of the eye मिलेंगे. You should always take your mind to it conjunctivitis. Red vision, pain, foreign body sensation. Now these are more or less now redness of the conjunctiva. This is a very important. All of these, most likely the symptoms in a case of conjunctivitis, prof में आए या viva में आए, these will be the 4 important symptoms which will be present. बाकी pain भी हो सकता है, fever, blood vision, all that can occur. But these are the 4 symptoms which will point you towards conjunctivitis. Redness, discharge, foreign body sensation, and itching of the eye. Now, conjunctivitis is inflammation. All right. Now, inflammation needs to have an infective cause, specifically in case of conjunctivitis, or it can be an endogenous, or it can be allergic. So, based on these 3 or 4 types, and there can be a different type of discharge in each case. For example, we know that in bacterial conjunctivitis, there is a purulent reaction, and the discharge will be purulent. In viral conjunctivitis, it won't be purulent, but it will be sticky. Similarly, in allergic, it will be sticky as well. So we can divide conjunctivitis into 3 types on the basis of the origin or the etiology. Now, before we discuss these 3 types, there are 3 important signs. I want you all, not 3 important signs, but important signs I want you all to tell. Signs क्या हो सकते हैं conjunctivitis के?
Follicles.
Follicles. Okay. So one sign of conjunctivitis is और क्या हो सकते हैं signs?
Papilla.
Follicles क्या होते हैं? Papilla क्या होते हैं? और क्या हो सकता है follicles और papilla के अलावा?
Signs.
Hyperemia, chemosis.
ठीक है. और अपने ज़हन में जो कुछ आता है, say it out loud. कुछ भी आ जाए. Follicles हो गए, papilla हो गया, hyperemia, chemosis. मिलके हिसाब से कह लेते हैं. Now, based on the signs and the symptoms, we can divide conjunctivitis into 3 types. Now, in one type, we will have follicles. In the other type, we can have papilla. And in the other type, we won't have any of the 2. But we can have some sort of discharge, right? So follicles, papilla, and then discharge की type क्या है? That can also be a very important symptom. Type of discharge. How many types of discharge are there?
Mucoid, mucopurulent.
Yes, mucoid, mucopurulent, and so we will match these symptoms and signs along with each other, and we will have an overview of the 3 different and the main types of conjunctivitis. But first, let's discuss what are follicles and what are papilla. We've discussed studied immunology. We have studied microbiology as well. So what are follicles? Follicles क्या होते हैं in immunology? आप लोगों ने immunology पढ़ी है ना? Already we discussed follicles. Follicles, are aggregations of immune cells, T lymphocytes mainly. Look at this picture. What are your findings? The three हमने important symptoms start में discuss किए थे, including redness of the conjunctiva, number 1. The second was discharge, 3 itching, and 4 foreign body sensation. These symptoms are only symptoms, but the redness and the discharge we can quantify on examination. So comment on the redness and on the discharge of this patient.
Diffuse redness.
Redness, that's good. And the discharge,
No discharge.
no discharge, right? And the most no discharge is visible. Diffuse redness because the circumciliary region is clear. Okay, we will assume that this person has left eye is only affected, right eye को उसको किताब ना देखना शुरू छोड़. Left eye, there is circumciliary clearing, कुछ भी नहीं मसला. There is diffuse congestion, and we cannot see any discharge. Now, when we perform slit lamp examination of the lower conjunctiva, which part of the conjunctiva is this we're seeing?
Palpebral.
Palpebral conjunctiva, right? So when we evert the palpebral conjunctiva, this is what we see. Diffuse light, and this is what we see angle light. Specific एक angle पे light आ रही है. Again, look at this picture. These are follicles. You can look at them again. These are follicles. Follicles are aggregations of B lymphocytes and T lymphocytes, or in simple terms, immune cells in the palpebral or the bulbar conjunctiva. They will appear as rounded elevations. And an important thing you have to keep note about these elevations is that क्योंकि conjunctiva में blood vessels होती हैं, the blood vessels of the conjunctiva, they appear over these follicles. Follicles के ऊपर से गुजर रही हैं. Can you appreciate this thing? That the blood vessels of the conjunctiva, the follicles को अंदर penetrate नहीं कर रही. They're not going into the substance or material of the follicle. They are going inside, over the follicle. Right? Keep this thing, it's very important. Keep this in mind. इसी वजह से the follicles, they are appearing like blisters, clear blisters. ऐसे लग रहा है कि नहीं लग रहा कि they are somewhat whiter and somewhat clearer, somewhat transparent than the surrounding conjunctiva. These are follicles. These are conjunctival follicles. Follicles किस disease में होते हैं? Does anybody know? Follicles are an important finding, an important sign in conjunctivitis. Why? Number 1, because follicles are present in viral conjunctivitis. Secondly, they are present in chronic conjunctivitis. Chronic conjunctivitis का मतलब है कि the conjunctivitis is long lasting, it's not acute, it's more time. I don't know the approximate definition time period, but there are some diseases which are called chronic conjunctivitis. Most important of those chronic conjunctivitis for our learning is trachoma. Trachoma क्या होता है? Does anybody have an idea?
Media trichomatis का infection.
Immediate trachomatis. There are serotypes of immediate trachomatis. You all know there's serotype ABC, then B through K, then L1, L2, L3. Glaucoma is caused by serotypes ABC. Glaucoma is a bacteria, so it's a bacterial conjunctivitis. Now, out of these two, what do you think this disease is?
Viral conjunctivitis.
Viral conjunctivitis. And what, is it not trachoma?
Because trachoma में discharge होता है.
बिल्कुल. Now, one thing very important, the discharge, nature of the discharge. Okay? Now, that is one important thing. The other things are that trachoma has other constellation of symptoms. उनमें follicles के अलावा और भी काफी गड़बड़ होती है. So, point being, the point which you have to remember that. What are follicles? They are aggregates of lymphocytes in the conjunctiva, and they signify, number one, viral conjunctivitis, number two, chronic conjunctivitis, meaning trachoma. Basic chronic conjunctivitis को आप भूल जाएं. You have to remember these two things. Follicles are in viral conjunctivitis and follicles are in trachoma. So these are follicles. Secondly, are papillae. Now look at this picture. You can look at this picture of the right eye. What do you see? क्या इसमें important finding है? एक ही है सिर्फ.
Hyperemia.
Hyperemia. What kind of hyperemia?
Diffuse.
Circumciliary region is clear. You can see that there's a white area around the corner. Now, if I were to evert the upper lid of this patient, this is what I would see. This is what I am seeing on the upper lid. And if I get a closer look of the cornea, this is what I am seeing. This is the same. This is upper lid, and this is. Let's focus on this. इसमें हमें क्या नजर आ रहा है? You can simply tell that there are certain elevations, certain masses, certain nodules of sort which are appearing over here. Do you think these are follicles?
No.
No.
Why are these not follicles?
Follicles pale होते हैं.
Pale होते हैं बिल्कुल. And secondly, another important thing.
ज़्यादा और elevated नहीं होता है.
इतने ज़्यादा elevated नहीं होते. That's a very good finding. Very good fact. ऐसे ही है. Follicles इतने ज़्यादा नहीं होते, इतने होते नहीं है. एक और चीज़ मैंने बताई vessels के बारे में.
ब्लड वेसल्स इनके ऊपर से गुजरी होती हैं.
बिल्कुल. Now, in follicular conjunctivitis, or if there is a follicular pattern, the blood vessels, they are on the surface of the follicles. इसकी वजह से वो translucent नजर आते हैं और blood vessels ऊपर नजर आते हैं. We can see that these elevations, these masses, these nodules, right? They are not as pale, and there are certainly no blood vessels on the top of them, meaning that they are blood vessels ऊपर नहीं है, and secondly they are not pale. They are well diffused or perfused with blood. Blood gives them this color, right? Meaning that the blood vessels, they are inside them, and they are receiving a well amount of blood. So these elevations, these are papillae. Okay, these are papillae in the upper palpebral or tarsal conjunctiva. अब papillae होते क्या हैं in terms? Does anyone know what papillae are?
Hypertrophy of the epithelium.
Hypertrophy of the epithelium. ठीक है, that's one-way structure. In general, papillae आप बहुत जगह पढ़ेंगे. आप जब पढ़ेंगे thyroid, we will study a papillary carcinoma of the thyroid. And we will
Finger-like
study
projections.
finger-like projections. ठीक है? Now that is a general term we use for things called finger. They are called finger-like projections. Papillae, right, you're right. Papillary are hypertrophies. They're hypertrophied tissue or they appear like finger-like projections. Although we cannot appreciate those finger-like projections in this case. Papillary are basically proliferations of tissue, in that they are hypertrophied. And these proliferations, they contain a fibrovascular core. इस बात के को क्या समझ आएगा? We saw that follicles, they were hypertrophy. Follicles were hypertrophy. Hypertrophy का मतलब होता है ना, there is increase in size or number. So they were hyperplasia or hypertrophy, whatever you can say. क्योंकि size ही बढ़ रहा है, T cells का number ही बढ़ रहा है. So that was an increase in the size and the number of the lymphocytes. But we saw that there was no vessels. There were no vessels going inside the follicles. They were translucent from the inside, and the vessels उनके ऊपर से गुजर के चली जाती थी. Papillae, when there is an increase in the size of the cells, there is increase in the number of the cells. But that increase in size and increase in number is also accompanied by increase in vascularization and the fibrous tissue, meaning that these elevations or these nodules which you are seeing, they contain tissue, they contain cells, they contain the fibrous component as well, and they also contain vessels. This is the important point, the important difference between the two. But that both are proliferations, but one proliferation is also contains blood vessels with them. Proliferation which contains blood vessels along is called papilla. These are papillae. Now again in this picture, we're not able to appreciate such as that much because these are also papilla, but they're not around the same color as well vascularized in this picture. Important thing here is that these are papilla which I filled. Now, if I were to tell you that this was a patient who presented to you with watering and itching in his eyes, and they were papilla, what would you say the diagnosis would be?
Allergic conjunctivitis.
Allergic conjunctivitis. So we've already drawn an association between papilla and allergic conjunctivitis. This is important. This is what you have. Now, allergic conjunctivitis can either due to be an exogenous allergen, हवा में कुछ बाहर है, anything outside the body. Or this allergic reaction can be due to an endogenous allergen, meaning that there is something inside the body which has caused an allergic reaction. तो उन दोनों के आगे different types आ जाती हैं. We will study them when we study allergic conjunctivitis. But in both of those, and also the further subtypes, we will have papillae along with itching. So this is another important thing. Now, coming on towards the discharge. You know that discharge is either mucoid, it's mucopurulent, or it's purulent. Now, these are three pictures of discharge. We've already discussed this one. We've said that this is mucopurulent or mucoid somewhat discharge because it does not contain that much pus. Now, look at this picture. What type of discharge do you think this is?
Mucoid.
Why do you think it's a mucoid discharge?
Because it's clear.
Where is the discharge in this picture?
ये जो ऊपर है ये डिस्चार्ज है.
ऊपर अराउंड
Eyelashes पे
eyelashes पे ना,
Eyelashes.
राइट, ये डिस्चार्ज है तो eyelashes पे स्टिक हुआ हुआ है इस वक्त. दिस इज डिस्चार्ज एंड सिमिलरली दिस इज द डिस्चार्ज, दिस इज डिस्चार्ज. ये eyelashes पे यहाँ भी डिस्चार्ज है, यहाँ भी डिस्चार्ज है. So what kind of discharge do you think this is?
जो कंजंक्टिवा पे है लेफ्ट साइड पे वो डिस्चार्ज नहीं है.
वहाँ पे इस वक्त लेफ्ट साइड पे दिस इज नॉट डिस्चार्ज, इज आइदर मतलब टीयरिंग ऑफ फ्लूइड, कुछ भी हो सकता है, बट दिस इज आई थिंक इफ इवन इफ दिस डिस्चार्ज इज नॉट म्यूकॉइड डिस्चार्ज. ये जो दरमियान में एक हमें नजर आ रहा है कि देयर इज समथिंग बिटवीन द टू लिड्स, व्हाट यू सेइंग. बाकी तो कंजंक्टिवा इज मोर और लेस क्लियर. This can be anything, this can be an artifact, कुछ भी हो सकता है, I'm not sure, but this is not the discharge in this case. So it can be tears, fluid, or anything else. The discharge is what is sticking to these eyelashes. ये conjunctiva में यही होगा. The discharge will be between the two lids and it will stick to the eyelashes, even if the eyes are clear. So coming back to this discharge, what kind of discharge do you think this is? Purulent.
ये eyelashes भी स्टिक हो रही हैं.
Stick हो रही है, right? This is either purulent or mucopurulent. Because it's difficult to judge the purulency or consistency if we do not actually know what we're saying, right? हमें तो सिर्फ नजर आ रहा है इस वक्त. अब हमें पता है कि purulent is thicker and mucoid is somewhat lighter on the side. मतलब it's less sticky and it flows easily. The mucoid, if it's clearly mucoid discharge. So this is mucopurulent or purulent discharge. So this was if we say that both are mucopurulent, which means that इसमें mucoid component ज़्यादा है, इसमें mucoid component कम है. There is more pus in this one. But again, this is either mucopurulent, severely mucopurulent, or purulent discharge. And this third picture. Now I'm going to tell you one thing over here before you tell me what this is. This is covering the conjunctiva, right? And you can see the bases of the vessels over here. Now, this thing, I can peel it off the eye. If I anesthetize the eye and I use a gentle cotton swab, it comes off. What is this?
mucoid discharge.
This is discharge, you're right. This is discharge.
Mucoid.
But if
Discharge.
it were mucoid discharge, the eye should have been clear. It should have been completely white. But there is somewhat purulent component in it. ठीक है, अगर purulent component ना होता तो it would have been completely clear. बाकी सब कुछ आप छोड़ दें. So you might think that the eyelashes are somewhat odd. Yes, that is true. The eyelashes are odd. They're diverted outwards. There's an ectropion. The important thing I want to focus is on this. And I'm telling you one thing, that this thing can be peeled off. What do you think this is?
Membrane.
Membrane. It's a membrane. So a membrane that can be peeled off. What is it called?
Pseudomembrane.
Pseudomembrane. Pseudomembrane कहाँ होती है? कहाँ बनती है? किस चीज़ से बनती है? Then that's what you've identified. But that is a pseudomembrane. I'm talking that. Do you know? Is there any disease in which there is a pseudomembrane formation?
Diphtheria.
Diphtheria में classically pseudomembrane कहाँ बनती है?
Throat
disease
में.
पढ़ते हैं.
Throat में
You're
pharyngeal.
right. There's a pharyngeal pseudomembrane. So if there's a pseudomembrane formation in front of the eye, it will be what do you think is the disease causing this membrane formation, and what we call this conjunctivitis?
Diphtheric conjunctivitis.
Diphtheric conjunctivitis. This is a diphtheric or pseudomembranous conjunctivitis. So अभी तक हमें जो चीजें समझ आई हैं in terms of discharge. No, we know that mucoid discharge will be with इन दो में हो सकता है. वायरल में हो सकता है. सेकेंडली किस में हो सकता है?
Allergic.
We know that mucopurulent and purulent will be in bacterial. Okay. In order for pus to be present, we need to have neutrophilic invasion, and we know that neutrophils are excellent against bacteria. Viruses के खिलाफ lymphocytes ज़्यादा काम करते हैं. इसी वजह से क्या होता है? एक साइन नजर आता है हमें. कौन सा साइन? Follicles.
Follicle.
Other thing is that pseudomembranes ये काफी स्पेसिफिक है. एरिया एक तो और डिजीजेस में भी हो जाते हैं. Basically, a pseudomembrane means that there is so much discharge, so much purulent discharge that it is covering the normal membrane to such an extent that we think that there is another membrane on top of the normal membrane. But it's a pseudomembrane because it can be peeled off easily without any further peeling, and it does not have any connections other than simple adherence to the underlying surface. Now, in all this discussion, we've discussed the symptoms and we've discussed three important things. We discussed three important signs. We've discussed the discharge, we've discussed either the presence of papillae, and we've discussed the presence of. Now, coming back to the important but the hard symptoms of conjunctivitis: redness, discharge, foreign body swelling, and itching, and some signs of conjunctivitis. What type of discharge? And redness. We can quantify redness also, but in conjunctivitis we know that the redness is diffused. Circumciliary है तो उसका मतलब है कि keratitis भी है साथ. Now, based on the combinations of these four symptoms in these three important signs, we can sub-classify conjunctivitis into three types. We can classify it to viral conjunctivitis, we will classify it into bacterial conjunctivitis, and we can classify it into allergic conjunctivitis. Now, first discussing viral conjunctivitis. Viral conjunctivitis के क्या signs और symptoms आपको लग रहे हैं? क्या हो सकते हैं?
Mucoid discharge.
Symptoms पहले.
Pain, discharge.
Pain हो गया. Hard symptoms. These four hard symptoms. I'm only discussing the redness, discharge, foreign body, and itching, or enlarged visual. Okay, so there will be a redness of the eye. There will be a discharge. There will be foreign body sensation होगी इसमें. It's a plus or minus, right? हो सकती है. Foreign body है किसी में हो सकती है, लेकिन specific इसमें जरूरत नहीं है. So it's a plus and minus. हो सकती है, नहीं भी हो सकती है. Somewhat soft in differentiating the different types of conjunctivitis. Itching होगी इसमें नहीं होगी. नहीं होगी, right? So in a case of viral conjunctivitis, you will be present with these three symptoms. When we go towards the signs, discharge कौन सा होगा इसमें?
Mucoid.
Follicles होंगे?
Yes.
Papilla होंगे?
No.
So this is how you will be given a case of viral conjunctivitis. There will be patient present with redness, discharge, foreign body sensation हो सकती है. Mucoid, a discharge will be mucoid, and he will have follicles. Follicles हमें पता है क्या होते हैं, और हमें पता है कि viral में क्यों होते हैं. Because the response to viruses is the proliferation of the lymphocytes, or follicles are basically applications of lymphocytes. वायरल कंजंक्टिवाइटिस की जो डिफरेंट आगे सब टाइप्स हैं, उनमें दरअसल जो किस्सा कहानी वो यही होती है कि फॉलिकल्स कहाँ होंगे, कितने होंगे, किस तादाद में होंगे, and also if there are any other associated systemic diseases or signs. For example, this patient presents with pharyngitis, मैं लिख रहा हूँ slash cough, or this patient can also present with एक symptom किसी ने बताया था दरमियान में, क्या था वो symptom?
Lymph node enlargement.
Enlarged lymph nodes, right? Enlarged lymph nodes. These are other clues which will point you towards a viral diagnosis. So this would be most probably a case of viral conjunctivitis. Moving on to allergic conjunctivitis. What do you think will be the symptoms of an allergic conjunctivitis?
Itching.
Itching. Itching is a very important symptom. इसलिए हम सबसे पहले उसको लिख लेते हैं. We know that there will be redness. We know that there will be discharge and all that stuff. Allergic may we will have itching. We will have itching. We will have discharge. We may or may not have redness. बहुत सारे लोगों को एलर्जी होती है, उनकी आंखों में आंसू आना शुरू हो जाते हैं, पानी आना शुरू हो जाता है. लेकिन एक इम्पॉर्टेंट चीज होती है इसमें, और बड़ी सेंसेशन भी हो सकती है. Do you think that there's a relation between the onset of symptoms and any other factor?
Seasonal.
Seasonal. Allergies किसी को हैं आप में से? Somebody has allergies, they will know. If you don't have allergies, you must know that the trigger must be present. The trigger in case of exogenous allergy, it can be pollen, it can be dust, and hence it can be even the heat, severe heat, meaning that the trigger is present only at a specific time, and hence allergies are mostly seasonal. सीजनल क्या है? स्प्रिंग में एलर्जी ज़्यादा होती हैं, राइट? स्प्रिंग एंड समर में एलर्जी ज़्यादा होती हैं कंपेयर्ड टू ऑटम एंड विंटर. सो द टाइम पीरियड इज वेरी इंपॉर्टेंट एंड दिस विल मोस्ट प्रोबेबली बी गिवन टू यू इन द क्वेश्चन स्टेप. कमिंग ऑन टू द साइंस, हमने 3 साइंस डिस्कस किए थे. डिस्चार्ज कौन सा होगा इसमें? Mucoid discharge, right? The discharge will be mucoid. Will this person have follicles?
No.
No, follicles नहीं होंगे. ये क्या होगा?
Papilla.
Papilla. This is overview of any case of allergic conjunctivitis. That the person will present with itching, discharge, redness. The time period will also be given. In that his itching is more during the summers or winters, or signs or symptoms will appear more during that specific given time. अब एलर्जी की फर्दर सब टाइप्स में क्या चीज हमारे लिए इंपॉर्टेंट है कि ट्रिगर क्या है, चीजें ट्रिगर किया, whether it was exogenous, whether it was endogenous, and secondly the location of the papilla, where are these papilla located. So on the basis of these 2-3 things we further classify allergic conjunctivitis into its subtypes. If they've done viral, we've done allergic. Now one more, the last before we end this session. बड़ी हैरानी की बात है कि it's one this session टाइम आउट नहीं हुआ ये. I don't know why. So bacterial conjunctivitis. What will be the symptoms? क्या हो सकता है?
Redness होगी.
डिस्चार्ज होगा. पेन. ठीक है, these are more or less. Foreign body sensation भी इसमें हो सकती है. Itching नहीं होती. You have to remember that. Itching, histamine, allergy. That is an important connection. कभी-कभी it's very important that the whole MCQ rests upon that connection. Symptoms हमने कह लिए. Signs. Discharge कौन सा होगा?
Purulent.
Discharge will be purulent or mucopurulent. Follicles होंगे?
No.
No. Papilla होंगे?
Yes.
क्यों होंगे? Papilla होते हैं बैक्टीरियल कंजंक्टिवाइटिस में नहीं होता है. You have to remember this. Papilla or the fibrovascular proliferations, they are present in allergic conjunctivitis. ना follicles होंगे ना papilla होंगे. They can be pseudomembranes, etc. Based on these symptoms and signs, will you now be able to differentiate between a bacterial conjunctivitis, an allergic conjunctivitis, and a viral conjunctivitis? क्या अभी आप differentiate कर सकते हैं इन signs और symptoms के basis पे कौन सा होगा bacterial, कौन सा होगा viral, कौन सा होगा allergic? ठीक है. मैंने एक और छोटी सी बात की थी कि follicles chronic conjunctivitis भी होते हैं. Chronic conjunctivitis हमने डिस्कस किया था ट्रोकोमा. And trachoma is a bacteria, Chlamydia trachomatis, right? So I'm not writing it down over here because trachoma is a separate topic. हम as a separate topic उसको बाद में discuss करेंगे. But you have to remember that these follicles, they appear in trachoma as well. Now these are the three further subtypes जिस पे हम आगे session start करेंगे इंशाल्लाह. In the next session we will start with bacterial conjunctivitis. The important thing is that if you remember these symptoms and signs, आगे जो इनकी सब टाइप्स हैं वो इनके कॉम्बिनेशन से बनी हुई है. मीनिंग दैट इन वायरल फॉलिकल्स कहाँ हैं, कितने हैं, साथ सिस्टमिक डिजीजेस और साइंस क्या है. इन एलर्जिक ट्रिगर क्या था, एक्सटर्नल था, इंटरनल था, पैपिला कहाँ है, कितने हैं, और टाइम पीरियड कोई था इसका, सीजनल था या नहीं, इसकी बेसिस पे एलर्जिक क्या डिवीजन है. सिमिलरली इन बैक्टीरियल डिस्चार्ज म्यूकॉइड था या पेरुलेंट था, स्यूडोमेम्ब्रेन बनी थी या नहीं बनी थी, एंड देयर आर सम अदर एसोसिएटेड साइंस एंड सिम्पटम्स एज वेल जो हम उसके साथ इंशाल्लाह डिस्कस करेंगे. सो दिस वाज ऑल अबाउट, or not all about, a brief overview of conjunctivitis. First we did red eye and then we did the different types of conjunctivitis. बाकी details हम इंशाल्लाह सेशंस में करेंगे, but you have to keep these things in mind. Pseudomembranes, discharges, papilla, follicles, these are very important. Do you have any questions? किसी को कोई चीज सेशन में ना समझ आई हो? Anything at all? Because if you keep ये सब कुछ समझ आ गया ना आपको, आपके लिए conjunctivitis काफी आसान हो जाएगा. And if you can differentiate conjunctivitis from the other differentials of red eye, then you've covered at least 60 to 70% of your syllabus. The glaucoma, uveitis, orbital cellulitis, these are at least 3 to 4 questions in the prof.
डिस्चार्ज सीरियस भी नहीं हो सकता वैसे?
Serous. Now, why do you think that discharge is not serious? मुझे मैं कहता हूँ, आपने कहा कि serious हो सकता है. I am saying serious नहीं होता. There's a logic behind things, right? क्या logic है if I'm telling you कि serious नहीं हो सकता? Does anyone know? पता है? Second year में जब हम histology पढ़ते हैं, we discussed that for clear secretions there are two types of glands. One are serous and the other are mucoid. Serous कौन से होते हैं? Which contain water and all the sort. Saliva is serous. Pancreatic secretions are serous. Mucoid में mucus present होना चाहिए. And you know that mucus is produced by mucoid cells. Mucoid cells stomach के अंदर होते हैं, but they're not in the pancreas, they're not in the salivary glands. Similarly, when it comes to this, serous secretions of the eye, they are produced by the serous glands. Eye के इर्द-गिर्द serous glands कौन-कौन से होते हैं? In relation to the eye, the serous glands are lacrimal glands, right? They are lacrimal glands and the accessory lacrimal glands. Accessory की spelling है. Accessory lacrimal. Lacrimal के साथ छोटे-मोटे glands और भी होते हैं. They are serous. Now, mucoid glands कहाँ पर मौजूद होते हैं?
कंजक्टाइवा में
Conjunctiva में. Now the mucoid glands, they are present on the conjunctiva. Does the conjunctiva contain like serous glands? Nahi. Serous glands are present as acini and they're not present in the conjunctiva. This is the reason why in conjunctivitis the discharge can never be serous because the serous glands are absent. Serous secretions can be present in conjunctivitis, meaning that there can be lacrimation. उसको lacrimation कहते हैं. Tears which are coming. If there's a severe foreign body sensation, for example, if the person has allergies and he has foreign body sensation, but the conjunctiva is not as much inflamed, फिर उसमें lacrimation होगी, tearing होगी, discharge minimal होगा, और उसमें and all that stuff, right? So if the conjunctiva is inflamed specifically, you know that mucus glands are present in the conjunctiva does not have any serous glands. That is why in conjunctivitis that discharge will either be mucoid, mucopurulent or purulent. It cannot be serous because of the absence of these glands. ये चीज आपने याद रखनी है because it can come to you in an MCQ form. There are 3 layers of the conjunctiva. Conjunctiva की क्या layers हैं, उनकी क्या composition है. Do give it a read. And the reason why conjunctivitis cannot have serous discharge. किसी और ने कोई सवाल पूछना हो? Go through this again. I will send you the link. इसको दोबारा देखें. This is the overview, the gist of conjunctivitis. If you know these things, then more or less what will follow will not be difficult for you. So we will continue this in our next session. Take care. Allah Hafiz.